121. The nurse should monitor for orthostatic hypotension in patients with multiple sclerosis. True or false? Answer: true. Rationale: multiple sclerosis can impair autonomic function, causing orthostatic hypotension, increasing fall risk, and requiring monitoring per nursing care plans. 122. A CT scan is the primary diagnostic tool for epilepsy. True or false? Answer: false. Rationale: EEG is the primary tool for epilepsy, detecting abnormal electrical activity. CT scans identify structural causes, but are not primary per diagnostic criteria. 123. Autonomic dysreflexia is a complication of spinal cord injuries below T6. True or false? Answer: false. Rationale: autonomic dysreflexia typically occurs in spinal cord injuries above T6, triggered by stimuli like bladder distension, causing severe hypertension, per pathophysiology. 124. The nurse should teach patients with epilepsy to avoid swimming alone. True or false? Answer: true. Rationale: swimming alone poses a drowning risk for epilepsy patients due to potential seizures, requiring safety education, per patient education guidelines. 125. Trigeminal neuralgia causes vision loss. True or false? Answer: false. Rationale: trigeminal neuralgia causes severe facial pain, not vision loss, which is associated with conditions like optic neuritis and MS, per clinical presentation. 126. The nurse should monitor for decerebrate posturing in patients with brain injury. True or false? Answer: true. Rationale: decerebrate posturing, extension of arms and legs, indicates severe brain injury or increased intracranial pressure, requiring immediate intervention, per neurological assessment. 127. Amyotrophic lateral sclerosis affects cognitive function in all patients. True or false? Answer: false. Rationale: ALS primarily affects motor neurons, but only some patients develop cognitive impairment or frontotemporal dementia, per disease progression. 128. A patient with a stroke should be positioned flat to improve cerebral perfusion. True or false? Answer: false. Rationale: stroke patients should have the head elevated to 30 degrees to reduce intracranial pressure and optimize perfusion, per American Stroke Association guidelines. 129. Phenytoin can cause hepatotoxicity as a side effect. True or false? Answer: true. Rationale: phenytoin, an anticonvulsant, can cause liver damage, requiring monitoring of liver function tests, per pharmacology principles. 130. Meningitis can cause nuchal rigidity. True or false? Answer: true. Rationale: meningitis inflames the meninges, causing nuchal rigidity, neck stiffness, a hallmark symptom, requiring neurological assessment, per clinical features. 131. All patients with Alzheimer's disease require institutional care. True or false? Answer: false. Rationale: early-stage Alzheimer's patients may live independently or with support. Institutional care is needed only in advanced stages, per care planning guidelines. 132. The nurse should assess for ataxia in patients with multiple sclerosis. True or false? Answer: true. Rationale: multiple sclerosis can affect cerebellar pathways, causing ataxia, uncoordinated movements, requiring mobility assessments, per clinical presentation. 133. Baclofen is used to treat seizures in epilepsy. True or false? Answer: false. Rationale: baclofen treats spasticity in conditions like MS, not seizures, which are managed with anticonvulsants, per pharmacological protocols. 134. A patient with a traumatic brain injury is at risk for diabetes insipidus. True or false? Answer: true. Rationale: traumatic brain injury can damage the pituitary gland, causing diabetes insipidus, polyuria, thirst, requiring fluid and hormone monitoring, per neurotrauma complications. 135. Bell's palsy is a chronic condition. True or false? Answer: false. Rationale: Bell's palsy is typically acute and self-limiting, resolving within weeks to months, though rare cases may persist, per clinical features. 136. The nurse should monitor for fever in patients with meningitis. True or false? Answer: true. Rationale: meningitis causes fever due to infection or inflammation, requiring monitoring and antipyretics or antibiotics per nursing care standards. 137. Parkinson's disease causes intention tremors. True or false? Answer: false rationale. Parkinson's disease causes resting tremors, not intention tremors, which are associated with cerebellar disorders per clinical presentation. 138. The nurse should assess for language deficits in stroke patients. True or false? Answer: true rationale. Stroke in the left hemisphere can cause aphasia, language deficits, requiring assessment to guide communication strategies per stroke care protocols. 139. Peripheral neuropathy is reversible in all cases. True or false? Answer: false rationale. Peripheral neuropathy may be irreversible, e.g., in chronic diabetes, or partially reversible, e.g., vitamin B12 deficiency, depending on the cause, per clinical management. 140. The mini-mental state examination assesses motor function. True or false? Answer: false rationale. The mini-mental state examination assesses cognitive function, e.g., memory, orientation, not motor function, which is evaluated with physical exams per assessment tools. 141. Patients with epilepsy should avoid caffeine. True or false? Answer: true rationale. Caffeine can lower the seizure threshold, increasing seizure risk, requiring patient education on avoiding stimulants per epilepsy management guidelines. 142. All spinal cord injuries result in permanent paralysis. True or false? Answer: false rationale. Some spinal cord injuries, e.g., incomplete lesions, allow partial recovery, while complete lesions may cause permanent paralysis per injury classification. 143. The nurse should monitor for hypertension in patients with autonomic dysreflexia. True or false? Answer: true rationale. Autonomic dysreflexia causes severe hypertension due to unopposed sympathetic activity, requiring immediate intervention per spinal cord injury protocols. 144. Migraines are always unilateral. True or false? Answer: false rationale. Migraines are often unilateral but can be bilateral, with symptoms like throbbing pain and nausea, varying by patient per migraine classification. 145. The nurse should assess for Koenig's sign in patients with meningitis. True or false? Answer: true rationale. Koenig's sign, pain with knee extension, indicates meningeal irritation in meningitis, aiding diagnosis per neurological assessment standards. 146. Huntington's disease is preventable with lifestyle changes. True or false? Answer: false rationale. Huntington's disease is genetic and not preventable, though symptomatic treatment can improve quality of life per disease management guidelines. 147. A patient with a stroke is at risk for deep vein thrombosis. True or false? Answer: true rationale. Stroke patients with immobility are at risk for deep vein thrombosis due to venous stasis, requiring prophylaxis like compression devices per stroke care protocols. 148. The Romberg test is used to diagnose Alzheimer's disease. True or false? Answer: false rationale. The Romberg test assesses balance, not Alzheimer's, which is diagnosed with cognitive testing and imaging per diagnostic tools. 149. Increased intracranial pressure can cause vomiting. True or false? Answer: true rationale. Increased intracranial pressure irritates the vomiting center in the brainstem, causing nausea and vomiting per neurological emergency signs. 150. All patients with myasthenia gravis require mechanical ventilation. True or false? Answer: false rationale. Only severe myasthenia gravis cases with respiratory muscle weakness require ventilation. Most are managed with medications like pyridostigmine per treatment guidelines. 151. The nurse should assess for bradykinesia in patients with Parkinson's disease. True or false? Answer: true rationale. Bradykinesia, slow movement, is a hallmark of Parkinson's disease due to dopamine deficiency, requiring mobility assessments per clinical presentation. 152. All patients with meningitis require surgical intervention. True or false? Answer: false rationale. Meningitis is typically managed with antibiotics or antivirals, not surgery, except in rare complications like abscesses, per treatment guidelines. 153. A patient with a stroke is at risk for contractures. True or false? Answer: true. Rationale: immobility from stroke can lead to muscle shortening and contractures, requiring range of motion exercises per stroke rehabilitation protocols. 154. The Glasgow Coma Scale is used to diagnose multiple sclerosis. True or false? Answer: false. Rationale: the Glasgow Coma Scale assesses consciousness, not multiple sclerosis, which is diagnosed with MRI and clinical evaluation per diagnostic criteria. 155. Seizures can be triggered by electrolyte imbalances. True or false? Answer: true. Rationale: electrolyte imbalances, e.g., hyponatremia, can disrupt neuronal activity, triggering seizures, requiring monitoring in epilepsy patients per management guidelines. 156. Alzheimer's disease is caused by a bacterial infection. True or false? Answer: false. Rationale: Alzheimer's disease is a neurodegenerative disorder with genetic and environmental factors, not bacterial, per pathophysiology. 157. The nurse should monitor for respiratory depression in patients taking valproate. True or false? Answer: true. Rationale: valproate, an anticonvulsant, can cause respiratory depression, especially at high doses, requiring monitoring per pharmacology principles. 158. Peripheral neuropathy is always caused by diabetes. True or false? Answer: false. Rationale: peripheral neuropathy can be caused by diabetes, but also by chemotherapy, vitamin deficiencies, or infections, per clinical etiology. 159. Autonomic dysreflexia requires immediate removal of the triggering stimulus. True or false? Answer: true. Rationale: autonomic dysreflexia, a spinal cord injury complication, requires urgent removal of triggers, e.g., bladder distension, to prevent hypertensive crisis per emergency protocols. 160. The nurse should administer thrombolytics to a patient with a stroke after 4.5 hours. True or false? Answer: false. Rationale: thrombolytics for ischemic stroke are given within 4.5 hours of symptom onset, beyond which risks outweigh benefits, per American Stroke Association guidelines.